Yeah, we were called to this complex a number of weeks ago for reports of a bystander finding a newborn in a dumpster. And when we arrived, we were presented with, again, a newborn, and there was a number of bystanders at this time on scene providing what first aid they could and comfort that they could until emergency services arrived.
Two young girls walking by a dumpster in northwest Calgary had heard the cries of a baby and called for help. In minutes, a young man was in the dumpster and emerged with a newborn who had been put in a black garbage bag and tossed in a dumpster, allegedly by the young mother who had given birth just a couple of hours before.
It is difficult, especially if we have, like many of us do, young kids or newborns. Sometimes when we're in that back of that ambulance racing to the hospital treating these patients, it's tough not to think of your own children, right? But again, no matter how much training you go through, that vision will sometimes pop up in the back of your mind.
There is just a sliver of light in this story in that the baby boy survived because of the quick action taken. A police investigation is still underway to discover what really happened. Even though she doesn't know all of the details of this particular story, Jen Mast says she can identify with that feeling of desperation the mother of this young baby must have felt. Mast was 16 when she found out she was pregnant.
I can honestly see how someone in a crisis point could do that, because when I was at the crisis point in my pregnancy, initially upon finding out, and my mom, when she found out, she yelled a lot, and it was just kind of like, you just feel really desperate and terrified, and you're looking for a quick solution, a quick fix. It's absolutely surreal. And so when you kind of have that crisis thing, you're not thinking straight, and you're just in a moment of panic, and you just kind of quickly do what you kind of have to do in the moment.
Now a married mother of 3, she sought help 15 years ago from the Calgary Pregnancy Care Centre. They helped her weigh her options, and when she decided to give up her child for adoption, they were there to help. And even though she admits it was the hardest decision to make, she says it was the right decision for her child.
It's probably the most intense grief I've ever felt, but it's mixed with like absolute joy for them, because we got to know them, and you're so happy that they're finally becoming a family. You're so happy that your child has a wonderful home and amazing parents, but you're so sad for yourself, knowing what you're going to miss out on. And it's honestly, in the 31 years of my life, the hardest thing I've ever done. Mm-hmm.
For Jen, having the support of an organization like the Calgary Pregnancy Care Centre is what helped her through that difficult time. Wendy, Lowe-Executive Director of the centre, says providing compassionate care to women in difficult situations is what's important.
The people who work here at the center come from a Christian faith-based conviction, and what they're doing is to agree to be with people who are suffering through an unplanned pregnancy. And that looks different for different people. Sometimes it's a listening ear, sometimes it's practical assistance with baby clothes, being a birth coach for somebody who doesn't have anybody to go through labor and delivery. The number of services that we offer are incredibly, incredibly diverse, but it's really just being present with people.
Lowe says that the centre has grown over the 25 years since it's opened its doors, adding more services as they identified needs of their clients. She also recognizes that not all women find the help they need to make informed decisions.
Leaving a baby outside in the elements in Alberta is, a guaranteed death sentence most of the time. Babies can't survive outdoors for any length of time in our extremes of weather. So, the much better option is to pop by a fire station or an emergency ward and just turn around and walk out. They probably won't restrain you. So you do have options.
One of those options created in the U.S. in 1999 was the Safe Haven legislation, which allows infants to be left anonymously without any legal ramifications at safe drop-off places, including fire stations and hospitals. In May of 2010, Canada opened its first safe haven called Angel's Cradle at St. Paul's Hospital in Vancouver. Since its inception, one infant has been left anonymously, with the process set in place working successfully. Gordon Self, the VP of Mission, Ethics and Spirituality at Covenant Health in Edmonton, says they're currently looking at bringing the Safe Haven program to its hospital, but first they are carefully examining the need and the effectiveness of the program.
if Covenant Health decides to open an infant safe haven, that we want to make sure that it's augmenting an existing safety net, not replacing or working counter to or cross purposes.
Lynn Laskoski has been working with young single moms since the early 80s at Covenant Health. And having worked with crisis situations that have resulted in infant death among young moms, she sees the advantages of implementing the Safe Haven program.
It is a crisis situation. They have delivered completely alone, with often tragic outcomes where the baby doesn't survive. The idea that a safe haven could even save one of these infants would be worth it to me, to think that that could make a difference when nothing else does.
The Safe Haven legislation has raised concerns with regards to not having access to medical history and identity, as well as not being able to meet the acute needs of the mother. But Gordon Self says the primary concern should be providing a safe and secure place for a mother to leave her child.
Our obligation, our duty is to be present, to be Christ for one another. And we have an obligation to provide the best quality and safe care and compassionate care as possible.
For Jen Mast, she says that's what she was looking for 15 years ago, a compassionate, caring place that could help her through a very difficult situation. And because of that help, she is now able to give back as a peer counselor at the Pregnancy Care Centre in Red Deer, Alberta, helping many girls who were in the same situation she was in years ago.
I felt that little tug at my heart. It's like, okay, it's time to give back. And, you know, life experience is fabulous to have, especially in a ministry like this, because I can approach it a little bit differently, because I've walked in those shoes. I know how they're feeling, and it's just, I want to be able to do for someone what was done for me, because it completely changed my life.
So good to see you. It's good to have you here.
In Calgary, Alberta, Natalie Faith, 100 Huntley Street.